Hi gang, this is Dr. Jeff from Legacy Chiropractic and Northeast Indiana Disc Center of America. We are a branch of Disc Centers of America, a nationwide set of doctors who specialize in healing discs non-surgically. We're also nationally certified. So what we do is no joke. This isn't about stretching, this is about non-surgical decompression, okay? So if you've got a disc problem, what I want to do is take a few moments and describe to you the 3 different type of disc problems you may have. And then we're going to talk about a couple different solutions you may have. So come on in. Welcome. So I want to share with you the different types of disc problems you can have. So we've got a vertebra, a bone in the back. We've got the disc, which is a water balloon. Then we've got another bone. And then right in here, we've got the spinal cord and these things called the nerves. So when the bones are in perfect alignment, gravity puts pressure on the bones in the center and it puts pressure on the disc right where it belongs. But when the spinal bones shift and move out of alignment, all of a sudden gravity starts putting pressure on the disc where it doesn't belong. And then what happens is the disc, as you can see all the way around, starts to bulge out like hamburger meat. Until eventually there's enough pressure, and this is called a bulge. This is the first thing that happens. You bulge all the way around. Until there's enough pressure, and then what happens is when there's enough pressure, look at the bubble, then you have what's called a herniation. Now, a herniation is going to sit on the nerve or sit on the spinal cord here and not only cause pain in the area, that's called discogenic pain. When you stretch the disc because you're bulging it or herniating it, you're going to have what we call discogenic pain. That means generalized pain in your low back. You go from sitting to standing and it hurts above your hips. You twist, you turn, and it hurts. You can't really specify where it hurts. It's my rear end, it's kind of in my leg, in my thigh. That's called discogenic pain. That's pain from the stretching of a bulge or even the stretching of a herniation. Then the second type of pain is called a radiculopathy. Due to a herniation, and it's either a physical pressure on a nerve, or this disc can herniate and not touch the nerve at all, but you got to understand that inside the disc is chemical. And when it spews out, that chemical can irritate the nerve and you can have what we call radiculopathy. What that is now it's pain in the neck and the shoulders and the low back, but now you've got pain that shoots down an arm, you've got pain that shoots down a leg known as sciatica, or you have numbness and tingling in a nerve pattern. That's due to the herniation and the chemical or the physical pressure. And then finally, when you squeeze the disc enough and the herniation is out long enough, all the nutrients leak out and then you have what we call a decaying or degenerative disc. Think of like sandpaper now in here. So those are the 3 type of disc problems you can have. And ladies and gentlemen, there are 3, not 1, not 2, but 3 ways that you can help a disc. And the first way is surgery. Okay, surgery. The most invasive way you could do it is surgery. You can have what we call a discectomy, where they're going to come in, they're going to cut you open, they're going to lay you down, cut you open, and they're going to take a scissors and clip that part off the nerve. And you'll probably feel good for a little bit, but the problem is they don't heal the disc. So guess what happens in 4 years? The problem comes back. So there's a discectomy, okay? That's the minimally invasive surgery. The maximally invasive surgery is they go in and they cut this entire section out of your spine, they lift it off, they take the entire disc out, and then they put rods and screws in called a fusion. Ladies and gentlemen, out of those 2 surgeries, the statistics are alarming. A 74 to 80% failure rate with back surgery, which leads to the next one, or sometimes is the first one, is pills. So you can do the most invasive, which is surgery, discectomy or spinal fusion, 74 to 80% failure rate, or you'll go to the pills before or after. The problem is, I was just at a seminar this weekend and it blew my mind to hear the research. Do you know that the pain pills you'll be prescribed, hydrocodone or some type of pain pill like that, well, those are called opioids. And there's a big problem in this country. Because what I discovered and what I learned this weekend was, within 1 week of taking painkillers, opioids, you become addicted. And that's a problem. Or there is a third way. And the third way involves non-surgical spinal decompression. Again, I'm nationally certified in non-surgical spinal decompression. And I want to share with you that there is two forms of decompression out there. There's what we call the real form, the real deal, Holyfield, and then there are the fakes. Okay, so let's talk a little bit about that. So lots of chiropractors will advertise spinal decompression. The challenge is there are only 3 real decompression tables out there, and 2 of them are out of business. So there's the VAX-D, which is out of business. There's some tables out there. There's the DRX 9000, which they had problems. Tables out there. They work well, if you can find them. And then the last company, which has still been in business for a long, long time, is called Acuspina. And this table is called North American Medical or an Acuspina. Now this is a real deal, Holyfield, no joke, decompression table. But let's take a step back and let's talk about the advertising you've seen, because you've seen plenty of chiropractors advertise spinal decompression. And what is spinal decompression? Okay, so we're going to talk about what that is, but first let's talk about what it isn't. Okay, so most of the chiropractors out there who have what's called a Hill table or Chattanooga don't have a real deal decompression table. They have a traction table, and the research shows, and I can provide the research for anybody who wants it, shows that with traction, you traction out the entire spine from top to bottom like an accordion, and you'll only get a 50% success rate because you're not being specific to the one level that needs it, so you're wasting energy. So traction tables, if it is not a DRX 9000, if it's not a VAX-D or an Acuspina, again, the only company that's still in business, if it's not one of those 3 tables, then it is really a traction table. So you need to ask the chiropractor who's promoting decompression, if that's where you're going, what type of table is it? And then if it's not a real decompression table, you're only getting a 50% success rate. Because with real decompression, you have multiple things. So number 1, with real decompression, you have a tower that stands at least 7 feet tall. This is what we call a fixed tower. It stands 7 feet tall because this motor right here needs to go up and down on the specific measured angle of the level that you are trying to decompress. And what decompression really means is we're pulling open, we're tractioning the spine without muscle spasm. So we fool the muscles into relaxing, and then we separate, and when that happens, we create a vacuum and we suck the disc material back in. And one of the amazing things is there's a computer generated algorithm that you must know from your table. Is it logarithmic? Is it sinusoidal? Or is it oscillating? So that's another question you must ask the chiropractor with the decompression table. See, one of those 3 tables we talked about in our Acuspina, okay, our Acuspina, is able to do a couple things specifically. Pull on one disc level, which gets us a researched 86 to 90% success rate. Researched from Harvard, from Stanford, from the Mayo Clinic. Okay, Dr. Sheely, who's a neurosurgeon from Harvard, did the research on real decompression tables. And one of the main things that this 7-foot tower can do is this device with the pulley can go up and down based on the specific angle at that level we need it to. So it can take all the energy and pull on one disc, number 1. Number 2, we talked about algorithms. This Acuspina works on oscillation, okay? It works on oscillation. That means, and it's a sinusoidal. That means it's going to slowly ramp up and slowly pull open. And then an oscillation means, and what oscillation means is this. It means like a plunger, you take a plunger and you put it in the toilet and the water comes up and out, up and out. Same thing is going to happen in the disc material. So it oscillates at a very high frequency and it brings all of the nutrients in and then pumps all the toxicity out. You see, the thing is, this disc right here, this disc has no blood supply. So if we can't oscillate it, we can't get nutrients in and toxicity out. And that's the one thing with our machine, the Acuspina. It's patented for oscillation, and it also works on sinusoidal. So you need to have a 7-foot tower to pull, number 1. You need to have oscillation, showing a sinusoidal or algorithm or a logarithm, okay? And then the last thing is this. To be truly a real decompression table, you have to have the table where it's up like this, and then the patient can get on and stand there and then can be lowered. Because think about it, if the patient goes to sit up and get off, they're just compressing the disc again. So what this table does is it stretches and it relaxes the muscles at the same time, and that's what causes a negative pressure. That's why our Accuspina has a 86 to 90% success rate. So we talked about the 3 types of disc problems. There's the bulge, there's the herniation as it comes out like this, okay? Then there's finally the decay or degeneration. We talked about real decompression versus non-decompression. We talked about a 7-foot tower oscillation. We talked about the research behind traction, 50%. We talked about the research behind real decompression. Then we talked about your options. You can go for surgery, 74 to 80% failure rate. I know because I see them in my practice. You can get on the opioids. Within 1 week, you're addicted. Or you can try something else. You can try non-surgical spinal decompression on a real decompression table from a real expert who's nationally certified. If you want more information, head to our website, www.northeastindianadisccenter.com, or call us at 260-768-4712 and we'll get you some information. We'll get you the research. We're here to help you with your disc problem, your sciatica, your herniations, your bulges. We're here to get you back to your life without surgery. This is Dr. Jeff on Back Talk, talking back, fighting back on surgery, fighting back on pills, addictive pills, fighting back on the nonsense of fake decompression and non-results. This is Dr. Jeff, Legacy Chiropractic, Northeast Indiana Disc Center, saying have a great day.